in. So thank y'all again for being here. I want to say, hey, Mom. Hey, boys. If you're watching on Facebook Live, my name is Kianta Key. I am the group Senior Vice President of Digital at GCI Health, and that is a WPP health agency. I'm so thrilled to be with y'all. I have been a fan of BDO for years. My mom actually introduced it to me years ago, and she still is an active member, Mr. Reggie, so thank you for your vision. But we are so excited again to be here today and really talk about information as medicine and connecting Black women with reliable health information. And then we think about the theme for today, what now? We want to make sure, and I was talking to Mr. Horace about this earlier, what can y'all walk away with today, right? That you can apply to your day-to-day, to your work. And I think ultimately we are all purveyors of information. We make the news, okay? So now in this moment, how do we ensure we maintain access, quality, and reliability of health information for Black women? So I am joined today by an esteemed panel of ladies and a gentleman. We will, they'll introduce themselves because they can do that better than I will. And we'll go ahead and get started. Let the church say amen. Amen. All right. So we know that Black women face significant disparities in health outcomes. For instance, research from the American Society of Clinical Oncology found that nearly half of Black women with metastatic breast cancer never receive information about clinical trials despite having a mortality rate that's 3 times higher than white women. I also say that GCI Health and Health at WPP did a similar study where we found that 73% of Black women never receive information about clinical trials, but 80% said they are more than likely to participate if asked. So that's not an outlier. The research, the data is there. So I want to ask our panel, how can we ensure Black women get equitable access to information across pressing areas like breast cancer and all areas of women's health? I'll start with you, Bianca.
Hi, everyone. My name is Bianca Mays. I use she, her pronouns. I'm the National Director of Black Health Equity at Planned Parenthood Federation of America. I'm happy to be here. The topic of information means everything to me. Outside of Planned Parenthood, I'm also an adjunct professor, so I'm always thinking about how I can give my students information. And quite frankly, I think part of what we need to do, as well-intentioned as we are, is to remember that we are not talking amongst peers. We're talking to the public, and we have to change the way that we do that. And if that means that we have to be uncomfortable in the way that we have these conversations with them and how we present information to them in a way that is less clinical, in a way that feels like you might be talking to your auntie, to your grandma, to your neighbor, then that's what we're gonna have to do. And I'm gonna pass it because I'm a preacher's daughter, so I can talk all day long to the rest of the panel.
Hi, I'm Dr. Sharon Allison-Ottey. Everybody just calls me Dr. Sharon. Hi, my Facebook community. And so I am an internist and geriatrician by training, but I do health strategy. And one of the first in the world to publish on direct-to-consumer advertisement in African Americans. And this is important, and one of the founders with health literacy. So we have to hit Black women with the same way we hit them with a Bloomingdale sale, the same way we hit them with the Neiman Marcus sale or a Bergdorf sale, which I'll be at in about an hour. And that is, why is it important? And we laugh about it, but if we really keep it simple, if we really do make sure that Black women, and shout out to the men, the statistics say Black women and women across the board do direct health in their families. Mm-hmm. So let's not alienate men. So it is the woman that says, go get a prostate exam, et cetera. And so the best way for us to effect change is to be inclusive. Yes, keep it plain. But I did a survey several years ago with the African American Wellness Project, over 1,000 Black people. And we said, where do you want to get your information? Internet, community, blah, blah, blah. 92% said from my healthcare provider or someone connected to healthcare. So we have to, and I teach doctors how to speak English, right? Or Spanish or whatever. And I teach patients how to advocate for themselves and ask the question. We'll ask about a sale on a dress, but we will not ask a doctor, how do you really want me to take it?
My name is Kayla Nixon. I am the communications manager at the Society of Gynecologic Oncology and the Foundation for Women's Cancer. And I think as a public health communicator and patient advocate, it's really important for me to focus on the impact of messaging. And so I think Black women are pretty educated. We are proactive. And I think when we're given the right information, we know what to do with it. We take action. And so I think messaging has to be direct. It has to be fact-based, and it has to be tailored to us. So, for example, I think instead of saying uterine cancer rates are rising among all women, I think it's more important for us to be able to say directly to Black women that they are the group that's more likely to be diagnosed with uterine cancer, and also the group that's more likely to die from it. And I think when we frame our messaging in that way, it creates a sense of urgency that says to Black women, this is something I need to know about, and this is something that I need to do something with. And I think in that way, we are empowering them to advocate for their health.
Hello, everyone. I'm Horace Clark, VP General Manager with BlackDoctor.org. I think I'm the luckiest guy in this room right now to be on this panel. So one of the things I'll touch base on is really looking at when we talk about the value of information. I want to go back to what was said a little bit earlier in one of our panels around the word trust. So one of the things we look at is that this information has to be shared with our audience, male, female, from a trusted source. So when we talk about the word trust, we hear a lot of times the use of mistrust and distrust, and many times we use them, pretty much the same. But for us at BDO, there is a difference, right? And I think that's something that we have to look at. When we talk about mistrust, it's based off of a feeling or a notion that something isn't quite right? That can be overcome pretty easily. But when we talk about distrust, what we're looking at is based off of personal experience, a historical facts, right? And so what we look at is how do we overcome distrust with the information that we're putting out? And I think that's one of the things at BDO that we do extremely well. And I'll add just one bit of nugget to that, because there are a lot of information companies out there that really talk about health information. You can find it anywhere, right? We know that. The difference is really understanding culture, weaving culture in the communication that we put out. Because again, you can find out information, but culture is so important when we're talking to our audience, right? So one of the things is, how do we make grandma's mac and cheese a little bit more healthier, right? That's culture, right? And so I think culture plays a very important part in making sure that we can show the value of information, and then also it coming from a trusted source.
I love that, sort of defining the difference between distrust and mistrust, because you find people are using them differently. So to Bianca, as we're now seeing widely available trusted public health information being removed, abridged, revised, disappearing. How can companies step in and fill the void for Black women seeking health information?
This is such a pivotal moment in time. I think first, I challenge all of us in the room. You must say something on an individual level. As organizations, you must say something on an organizational level. What we're seeing right now is, quite frankly, dangerous. And you can see this happen throughout history. The destruction, the removal of information, of fact, of science leads to mistrust. It leads to patients getting diagnosed later or not at all. And part of our responsibility when we think about the privilege, the power that we have as people in education and people in healthcare leaders, we have an obligation to bring this forward, because there are people that are not picking up on that. I'm in public health. Of course, I'm going to go to HHS and see the differences. But the average person is not going to do that, because they don't know, one, if the website exists, and then two, they're not on it frequently enough to see that information has shifted from that website. So we need to talk about it so it becomes public information. I want to go on the subway in the city and hear someone say, do you know they just took information about HIV off the website? I want to hear that, because if that means I'm hearing it outside of my spaces, that means the public is learning to advocate for themselves and advocate against the removal of public information. We deserve this. This is our right as people to get information and have access to it. And the removal of that, the adjusting, the editing of that, quite frankly, is something that we as an entire humanity should be sticking up against and actually being a little bit less polite about. There's been some polite articles I've been reading, oh, the slight information. No, I think we need to be a little bit more pressing in how we're talking about this issue. I want organizations to also start thinking about your partners. There's a lot of strength in who you align with. There's a lot of strength in who you partner with. Do your partners share your values? Will they also, can you challenge them? Hey, we work together in this space. We share an infrastructure organizationally. We're gonna talk about this issue that we're seeing. We would like you to do the same. Let's challenge each other. If we can challenge each other to, I don't know, walkathons and other things that we do in the healthcare industry, why can't we do the same thing for what we're currently seeing right now?
All right, iron sharpens iron. I like that. Kayla, can you speak to your experience navigating the healthcare system as a Black woman diagnosed with uterine cancer at a young age? What challenges did you face in accessing reliable information, and how has your experience shaped your journey?
Absolutely. I was diagnosed with uterine cancer when I was 24 years old, which is pretty young. And the first provider that I saw was a white male, and my appointment lasted 5 minutes because he looked at me and said, "There's no way you have cancer." And in my persistence, I almost immediately saw another provider who, when I told her my symptoms, she immediately ran a gamut of tests, pelvic MRI, blood test, ultrasound, and then ultimately DNC, that where she discovered the cancer. And then she referred me to an oncologist. And I think if not for my persistence and if not for that immediate referral, I may not be here today. And so most of my reliable information came after my diagnosis from the two of them. But before my diagnosis, I didn't know a lot about uterine cancer or really any cancer because it wasn't something that had directly impacted me. No one in my family had really been diagnosed. But what I will say is that I had an example of advocacy through my mother because we both had cancer at the same time, and then she eventually passed away the same year. So I had uterine cancer, she had leukemia, we were battling cancer at the same time, and in her, I saw an advocate for herself, and then I saw her build a community of people around her who could speak up for her in the moments where she was vulnerable and maybe not able to do so for herself. And so that has kind of shaped my work, the work that I do, and my experience in that I really try to think about my personal experience when I do my public health communications. But I also think that it has shown me the power of self-advocacy and also the power of advocacy for others, and then also the power of building a community around you that can support you through these vulnerable moments where you may not have the strength or the resources or information to do so for yourself.
Thank you, Kayla.
Sure.
Dr. Sharon, as we know, representation drives healthier outcomes. When patients see providers who look like them and speak their language, they're more likely to adhere to medication, take on a new treatment path, or even participate in a clinical trial. But the reality is that the Black community is about 14% of the US population, and Black doctors represent Black doctors with an S, not blackdoctor.org. Black doctors represent less than 6% of all physicians. So knowing the likelihood that Black women will be under the care of someone who does not share their lived experience, what would you say, or what can all healthcare providers do now to support better health outcomes for them?
So shout out to the executive director of the National Medical Association, the Association of Black Physicians. Number one, and I'll say this because I said this at an NMA meeting before, remember, bias is bias. So while we as Black doctors believe that we may not have bias, we also have bias, right? Shout out to my colleagues. Socioeconomic bias, color bias, educational bias. So all physicians across the board, healthcare, not just physicians, because we want to hang this on doctors, right? But healthcare providers, nurses, the MAs, everyone that touches a patient, you have to understand that I have bias. That's number one. And how do I overcome the bias? When I talk to groups and say, everybody has bias, I can tell you my white colleagues are often like, okay, I'm not racist. No, you're not. You have bias. Okay, so what do we do with bias? Number one, empower the patient to know what they need to deserve, what they deserve to have. But number two, as many states and licensing boards now require, is that you go through all of the steps, and bias is actually one of the CME models. And then two, there are not enough Black physicians to take care of a Black patient in America. So that means that I need to educate my white counterparts, my Latino counterparts, lottie-dottie and everybody on how to, number one, be human first. Because it's not just language and culture. I don't speak plumber. I don't speak mechanic. I speak dollars. How much is that going to cost me? Now go back and tell me again what this means, right? And we need to allow patients to have active engagement. And so what can we do? We can engage the patient and empower them to say, what is my main problem? Why it's important? What do I need to do about it? And we need to tell doctors, nurses, whatever, speak human first. And this is your mother you're talking to. This is your wife. This is your daughter, and break it down. Did I answer your question? I hope
You
so.
always answer the question, Dr. Sharon. Thank you. Now this is for Bianca. Many women have a story where Planned Parenthood was a lifeline for them right in their community when they needed information, advice, or help. I know digital and social media are crucial avenues to get health information of Black women, but for those communities not online or in rural communities versus urban or suburban ones, what's the role of groups like Planned Parenthood in supporting this changing information infrastructure?
I love this question, especially when we talk about the disappearance of information. Word of mouth and meeting people where they are is going to be key. We have a program called Shop Chat, which I really love because, you know, as Black women, we spend a lot of time looking beautiful, putting in the work for our hair
Yes,
and
look at this
nails
panel, okay?
and everything. And let me tell you something. Through our Shop Chat program, we actually teach nail salon folks, nail techs, beauticians, how to talk to their own communities about women's healthcare. And I say this is so important because sometimes we can give the factual information. I mean, we have a chat text online, which is a part of our Planned Parenthood website where you can actually have a pop-up box in the corner or use your phone to text, and a real life educator, I used to be one of them, would provide you healthcare information in real time. And at the same time, we know that there are folks that are not going to have access to that. Maybe they don't have smartphones, maybe they don't have access to the internet. And so we have these programs in place where we are teaching not only factual information to our communities directly as Planned Parenthood, but now we're teaching the community to teach amongst itself factual information. Because sometimes you might not want to hear it from me, but you will hear it from your nail tech that spent 3 hours on your nails, like mine, right? So it's important that we change the audience sometimes of how we're talking to people and make it so we can start going back to physically giving people information, going into the communities. We even had a wonderful event where we went into barbershops and we talked to Black men about how they can help advocate for their pregnant wives as they go through the process of childbirth and childcare. So we have to think about what are the ways that we can traditionally go back into these communities, back into these spaces, libraries, anywhere that will have us. We can talk about healthcare in all kinds of settings, just adjusting ourselves. And so I think relying more on that with the rise of miscommunication, misinformation, with the rise of distrust and trust, going back to that human element that you were talking about, Sharon, earlier, is so critical. It's absolutely vital, and we have to do that.
I love that. Human to human in real life communication is just as important. I'm going to go to Horace and Bianca, but I'll have Horace answer this first. Pew Research data shows that 16% of Black people in the U.S. get their news from TikTok. But we know social media platforms like TikTok, Facebook, and YouTube are where people access health information, often misinformation. How can social media platforms be leveraged to disseminate credible information? And how can news outlets and organizations like BDO and Planned Parenthood counter misinformation?
Yeah. First of all, great question. You will not see me doing any TikTok dances at all today. So I think one of the things when we look at social media and the part that it plays as far as communication, it's not necessarily the platforms themselves, right? It's the content that's being produced and shared. So when you take BDO, for example, we're 70% women to our site. So we have about 2.7 million followers on Facebook. So when you think about how we leverage and tap into that audience on Facebook, it goes back to trust. When we look at doing our Facebook Live programming, where we have the best of the best in the medical fields, patient advocates, organizations, sharing wonderful information, sharing their stories, and our audience is able to see themselves in the people that are there. That's the type of information that we want to share. I'll take us back to the days of COVID when we were doing a Facebook Live, and there was a lot of misinformation that was going around about COVID, as we all know. One of the things that we found very interesting during this particular Facebook Live programming is that as we were monitoring the comments, there was someone that was putting information in the comments that was just completely out of line. We didn't have to correct that individual. We didn't have to jump in or block them. What we saw coming from our audience was something that was very unique. Our audience said, please stop that. We want this information. So our audience began to look at this as their platform. It wasn't BDO's platform, it was their platform. So what we've noticed is that the information is there. And so what we have to do is start making rock stars out of the people in this room today, right? Many of us don't want to be on camera, but again, how do we give a face to pharma, right? How do we make pharma more than just a building or a sign or a logo? How do we elevate the people that are here that are making a difference that we get a chance to talk to every day? So I think that's one of the ways that we can help deal with the misinformation out there, counter that. And again, we know that people will come along the way. We've seen it happen. But again, it's not necessarily the platform. It's the type of information that we're sharing. And we've had some success utilizing Facebook and other platforms. So those are some of the thoughts there.
I would say my answer is twofold. One, and I'm sure a lot of you remember this, but back in my day, you were actually taught how to use the internet. You were taught how to use social media. And I think that's important because we have access to everyone from anywhere saying anything. That is a blessing. That is a challenge. And so part of what we have to do is start teaching people, when you watch this TikTok video, go to that person's page. Who are they connected with? Do they come from a credible source? Because again, you can just hear anything on the internet, and it's a great thing, but it's also a challenge because we have sites like ourselves, like we're on Instagram, we're on TikTok, we're on all these things dispelling information. And it's great to be able to interact with people on that level. And at the same time, like you were saying, Horace, we need more people, individuals and organizations to come online to combat the everyday people just getting on and saying anything. You have the credibility, you have the education. You can get online. You don't have to have this big TikTok personality. You don't have to have all the sponsorships. You have the knowledge. Even if you shared a quick video online with your credentials and your work that you're passionate about, I guarantee you can find some audience that would love to hear from you. In addition to, having organizational accounts that are able to discredit, we need individual people too that are knowledgeable in their fields to also help us combat it. Because sometimes, again, they might not want to come to specific organization pages, but they will say, oh, she's a Black girl in public health. I am too, and might tune in to me because they might look at me and say like, oh, forget where she's, what she's doing on the outside. I connect with her on an individual, that human level that you were talking about earlier. And so again, it's really important when it comes to the information component that we also hopefully put some pressure on the social media accounts as well. I mean, it is dangerous to repeat information that is incorrect And we should also hold companies accountable and say, you know what, I expect more from you. I would like you to take this down because this is harmful. Being able to report pages that are just, putting out information that's frankly dangerous is a responsibility that we should also be doing as individuals and hopefully as companies as well.
Love that. This next question is for Kayla and Dr. Sharon. We know that care teams, media, and friends and family are trusted sources of information for Black women. We've also seen the role of influencers. So what role do you think influencers actually play in communicating information in a way that is understandable, empowering, and culturally relevant? And how can we best leverage influencers to help dispel misinformation?
I think influencers can be health catalysts, right? I think that they can be responsible for starting conversations and directing people to the correct information and resources. So we might ask influencers to maybe be responsible for encouraging people to get screened, for maybe encouraging them to schedule regular appointments, have conversations with family about family medical history, ask certain questions of your provider. I think those are things we can charge influencers with. And I think ultimately that's helping to dispel misinformation by having them direct their audience to the correct information in the correct places to get the things that they need.
So number one, your Google does not equal my MD. Okay, that's it. But the other part of that is that, I'm sorry, an actor, influencer, etc., with all my credentials, I can get one of them and put me on their site and have Dr. Sharon keep it real, but have you open the door. So open the door. Say colorectal cancer is at ridiculous rates, et cetera, but then end it and then bring on someone credible. It is not them versus us. It is all us. And so you use whatever tool you have to get information to people that are at high risk or at moderate risk and need information and sponges. So if mama who had a 6th grade education can say, baby, I'm gonna need you to go get that colon thing. I want that. I want any information that will cause action. So influencers partnered with credible resources, and BDO does it better than probably anybody in the industry. You all do, because you will see the tagline of a famous person that has a health condition, and then you read it and you partner with a physician. You partnered with the leading expert. That is roadmap for success. And then a call to action. I want the influencer to say, yeah, you saw this is funny, whatever. But by the way, call your doctor, take your pill, or go exercise or do something. So it's all of us together.
Yeah, I love that. And I think Little John was just in a campaign encouraging people who have partied to his music back in the day, to use your phrasing, to use Cologuard, get their colon checked for colorectal cancer. Kayla, it did sound like you were like influencers. Did you want to add a little bit more into that?
Kianta and I met a couple of years ago in Puerto Rico, and we had a very strong conversation about this, because I do feel like in a lot of ways, when influencers are irresponsible, then they are the parties that are putting the misinformation out there. So I think it's less about them putting the information out there and more so directing people to where they can find the correct information. So I'm not necessarily, and it could just be because I'm a millennial, I'm not Gen Z, I'm not looking to hear health information from someone who does makeup, and that's just the reality of it. But I do recognize that Gen Z, and there are some other people that may be looking for it. So there's a place for them, but I think it has to be very pointed. And I think that they have to have direction to say, this is specifically what we want you to say, and then this is specifically where we want you to direct people.
So some guidance, a playbook
Absolutely.
of sorts, so they know what to say. Great. So this is our last question, and I want the panelists to just fill in the blank here when I say information is medicine because, and then you'll say your answer. Okay? All right. So information, Bianca, information is medicine because...
I hate that I went first. Information is medicine because it is revolutionary. Something that comes to my mind is whenever we do have the human interaction with patients, when I used to work at the hospital and I would give them a lot of information, I would actually have them repeat it back to me so I knew that they understood what I said. Because to me, you understanding the visit, you understanding the medication adherence that I just gave you is part of your revolution as an individual. It's not enough for me to just give you a bunch of information on STIs per se and then walk out of the room. It's empowering to me and revolutionary to you for you to be able to repeat to me what you heard about what I shared, what actually retained with you. And that to me is a revolutionary act. So
You had it. Information is knowledge.
yeah.
Information is knowledge. Okay, Dr. Sharon.
Repeat the question.
Information is medicine because
It may not taste good, but it's good for you.
I love
Period.
that.
Period.
Love it.
okay, mic drop. Okay, Kayla, you have to go after that. Information is medicine because
Information is medicine because I think knowledge is power. So I think once the information is out there and once we know what to do, then we can go out and do what we're being told to do. And I think that in that way, we are empowering women, specifically to this panel, but also everyone with the knowledge and the information that they need to improve their own health and advocate for their own health, but it also collectively improves our health.
I like that because we're all interdependent. I think someone said that
Absolutely.
earlier. Okay, Horace.
Oh, okay.
Information is medicine because
Because information is medicine, because it is the beginning step to uplift our community. So without having that information, and we talked about empowerment, I totally agree with you on that. Without having that information, that knowledge, we're not able to become the best advocates that we can for ourselves, our family, and our community. So with that information lays the groundwork for us to go out and do the work that all of us in this room are working to do each day. So again, I love the question, and when you shared it with me, I thought about it and said, hey, you know what? It's really something that we have to look at, because without having that, we can't make a difference, right? We can't change our situation within the Black community or within any community in the U.S. So thank you for that.
thank you. I don't see my timer. Are we good for questions from the audience? Any questions?
We didn't get the time. Yeah, we're
I
good.
know. Yes, ma'am.
So I have a question that's not as a gotcha question to the doctor. Did you go back to him and say, you missed this and you couldn't miss it? And again, not as a gotcha to him, but as an education to him so it doesn't hurt the next one.
I didn't, but that's a great point. I probably should have and still could.
Yeah, just send him the note.
He was a colleague of the provider the second provider that I went to. So I'm almost positive she most likely said something to him, because to this day, I still see her and she always says, I'm still the youngest patient that she's ever had to be diagnosed with that specific kind of cancer. So I'm almost positive there was a conversation that was had amongst them. Right. Agreed.
Any other questions? All right, seeing none, please give a hand clap to this amazing panel. Thank you all for being here today again. Again, my name is Kianta, part of GCI Health and WPP. And hey, Mom. Hey, boys. Have a good day.